Okay, here we go. So we'll go through the answers. Your answers don't have to match this exactly. These are just the answers that were either in the quizzes or, straight from the material. It doesn't have to be word for word. Use your discretion about if you feel like it's close enough. If you have questions, this is open discussion. Okay, does that make sense? Some thumbs up. I can't see anybody. Okay, so what best describes, and we can lecture off these too. So if you guys have questions about the questions or about the topic, this now's the time for us to talk about it. Best describes the thyroid gland without an end, because apparently my keyboard had no ends this day. Straight from the quiz, regulates energy and metabolism. Right. The XY plane of the body is the transverse or lateral medial plane. You could just have transverse. You don't have to have all of the names for it. Okay. An injury is lower on the limb and is said to be distal, away from, distal.
Like distance.
Yep. Distance from, it's all based off of the spine. So farthest distal, far away. Defined anemia, reduction of red blood cells or amount of hemoglobin in them. Bradycardia, abnormally slow pulse rate. Hypertension, abnormally high blood pressure. DVT, deep vein thrombosis. Okay, 5 is the diaphragm, 7 is the pelvic cavity, and 4 is the thoracic cavity. Okay, all 3 of them correct to get the full point. Best describes the pituitary gland, controls all other endocrine glands. Adrenal gland secretes hundreds of compounds. Okay, any other answers? Need clarification? You guys doing okay? Throw some thumbs up so I can see something. Okay, IUGR, intrauterine growth restriction. LBW, low birth weight. NST, non-stress test. Digestive enzymes are made here. Pancreas. Indigestible food and water is stored in the large intestine. Kidneys receive about what percentage of cardiac output? 25. Name one function of the liver. Okay, so you could have any one of these. Bile secretion breaks down fats, carb metabolism, detoxification. Anybody have any others that they're wondering about? Hey, you guys can just jump in. You don't have to wait, otherwise I'll just keep rolling. Name one function of the kidneys. Hormone secretion, regulation of pH, regulation of blood pressure. . PIH, pregnancy-induced hypertension.
For that last one, I had increasing red blood cells too. Is that right?
The function of the kidneys or the liver?
Yeah. Yeah, the kidneys.
Increases red blood cells.
Yeah.
Is that what you're saying?
Yeah, I had it, but I had controlling blood pressure, but I also put like increases red blood cells.
It's one area of the body that can increase the red blood cells. Red blood cells are also produced in the long bone, so that's not just unique to the kidneys. It's not fully wrong, but it's not something that's just unique to the kidneys. But I'll still give you the point because you had regulation of blood pressure. Okay, left kidney is slightly larger and lower than the right. False. The broad anterior border of the vulva is formed by the mons pubis. Clitoris is a complex and mostly internal organ. True. Hey, nosy man. Okay, all of these correct to get the full point. Otherwise, you know, half point or quarter point or 2/3 point as appropriate. M is labium minus. C, labium magnus. I would also accept labia majora and labia minora. D, external urethral orifice. I would also accept urethral opening. A, mons virinus. I would also accept mons pubis. And what's the other one that's also called regularly? Just the mons sometimes.
Yeah, the mons.
Yep. Any questions about this one? Okay, B, clitoris. N, vagina. F is a hymen. H is a perineum. Okay, any questions? Okay, C, cervix. L, uterus. E, vagina. M, ovary. Inani, take this guy. Okay. Son, no, please. Okay, just trying to get you guys really comfortable and really familiar with anatomical landmarks. Not because the chances of you seeing this internally is super high, but you know, we will see these in pictures, lots of pictures, especially when we get to like this lovely, can you see? I can't see anything.
Oh.
Yes, this lovely book. And when we get to you know, when we're starting to talk about pictures like this, is this okay? Centered-ish, sort of? No, I can't tell.
Yeah, looks all right.
You know, here's the pubic bone, you know, so being able to orientate yourself when we're talking about pictures like this. So that's, plus, you know, it's the anatomy of our profession. So just trying to get you guys really familiar with the landmarks.
And sometimes when you're thinking about the mons pubis, it's that little pelvic fatty pad on the mound of the pubic bone, and it's in front of the pubis symphysis.
Mm-hmm.
So like a lot of times women will have pubis symphysis pain, and that's in that general region of well, north of A.
Yep. Makes sense. Okay, so 26, bladder, I, pubic bone, D, rectum, and F, labium majora. And again, you know, this is a really common cross section. So getting us really comfortable with the landmarks visually. Okay, 27, H is the broad ligament. C is the ovary, B is uterine tube, and also accept fallopian tube. And E is the vagina. Okay, SGA, small for gestational age. SOL, other than feeling like we're shit out of luck sometimes, a spontaneous onset of labor. And that is sometimes how we feel when women are like, I think I'm in labor, but I'm not sure. Or I've been having this go on since 4 o'clock this morning and it's 7 at night.
Hmm.
The non-pregnant uterus lies tilted anteriorly towards the pubic bone. True. True. Okay, I have a good picture of that. This is why I need to figure out how to see myself as I'm, because I can't tell. I can't tell what what you're seeing. Okay, so bladder. Is this okay in the frame, twin?
Yep, you're
Okay.
good.
So
Your fat fingers on the bladder.
oh, sorry. Okay, so this is a book, and I'll be posting all these pictures later for you guys in a different unit, but this is a real life scale model. And so knowing these landmarkers, you can figure out, you know, where's the bladder, where's the cervix. You know, you can see the uterus tilted anteriorly sitting right on top of the bladder. And even just knowing this, I can surmise that this is a model of someone that's had a baby, because that's a pretty deep anterior tilt. Right. The cavity of the pelvis is basin shaped.
Would you accept bowl?
I would accept bowl. Yes. Yep. I was just gonna say that I would accept bowl. Okay. HVS, high vaginal swab. Not to be confused with HSV. We have some fun acronyms in our profession.
Or human villi sampling?
Oh yeah, that one too. Not as common. That's usually the
No.
gynecologists, not usually us.
Mm-hmm.
The female pelvic pubic arch is a 40-degree increase than a male pelvis. False is 30. I hope it's not 40. That girl's not gonna have a good day. Okay, so this is a really big landmarker, you know, so that's why this is the only one that I felt was pertinent on this picture. Okay, these ischial spines. Super important, because when we're talking more about baby position and how the baby is dropping down into the pelvis, that is a huge landmarker for babies as they're navigating down and in active labor. So ischial spine.
Would you take ischium?
Half point. It's pretty, it's because there's also the issue of tuberosities. I guess that's half of the label. So I'm not, it's particularly the spines. And that's, yep, so half point. Are you just throwing it out there, or are you reading the comments?
No, I'm reading the comments. And
Okay.
And personally, C is not the ischium. It would be south of D. So
Yeah. Yep, because it's very
It's
knowing that.
that outside
spine.
edge south of the ischial spine.
Yep. Yep. Because there's, I mean, there's, like I said, there's the ischiotuberosities, there's the ischial ligaments, there's a lot in that area that starts with ischial or ischium.
Yeah.
Okay, pelvic shapes, anthropoid, android, platypelloid. And I'm clearly not one to hound on spelling.
Was just gonna ask because I wrote the first one as arthropoid instead of anthropoid. Okay.
As long as you know that it's not a pelvis with arthritis. Yeah. Okay.
Yeah.
Yeah, anthropoid, andropoid, platypelloid. It's up to you how harsh you want to be on yourself for spelling. You know, if you want to take away a quarter point or not. I don't think you need to. I forgot a bunch of N's in this test, so. Okay, so the diameters, A is the left oblique. I would also just accept oblique. Transverse, right oblique. Again, I would accept just oblique because it being right or left, even though it's is based on where the baby's head is. And there's not a baby's head in the picture. So both A and C are oblique, and they could either be an anterior oblique or a posterior oblique. So I would accept just oblique for either of those as well. And then anterior posterior for D. I would also accept AP diameter. That's how it's just referred to. Like there's not very many that would say, oh, I had an anterior posterior baby. They usually say I had a baby in the AP.
Mm-hmm.
Okay, any
And they
questions?
usually would not even say, left or right oblique. It would just be like, I had a baby in the oblique, or I had a baby in the lateral oblique.
Yep.
So knowing that it's just that diagonal cross section of the pelvis will be helpful for you.
Yep. And more commonly, again, it's either anterior oblique or posterior oblique when we're conversing amongst each other is the common vernacular. It's not usually the left or right, because most of the time, just saying it's a posterior oblique is enough to make our buttholes pucker.
Oh. Already. I don't want to talk about it.
Right. Okay, there are two functional layers of the pelvic floor. The two sides of the pubic crest and the pubic arch are cushioned by the pubic symphysis. True, that's the squishy pad right here. The pelvic outlet is often divided into two triangular regions. True. Does everybody know what we're talking about there? This is not the pelvis. Soft tissue markers. Oh, sorry, go ahead.
Is it the urogenital triangle and
Yes.
the triangles?
Yep. So it's the soft, it's goodness, I should have marked this. Yes, it's the soft tissue, it's the visual.
It's in the workbook, isn't it?
No, I think it's, let me get to the textbook. It's in the textbook, I know it is for sure. Shoots, where are my sticky notes? Oh, Teeny ripped out my sticky notes. Weird.
It's the anal and the urogenital as far as the triangular regions, but when you're looking down at it, the pelvic bowl looks like a triangle.
Yeah.
I don't know if that's helpful necessarily, but one starts at the urethra and the clitoris, like up that cavity. And then the other one is anal, which is back to front as opposed to front to back.
Is everybody familiar with what we're referring to? Because I'm looking for a specific picture. Anybody need clarification?
Can somebody kind of see like that? Can you guys see how there's a triangle on top and
Yeah.
a triangle on the bottom?
Literally, I was pulling up the same picture. Yep. Yeah, so you got the, and it's, yeah, again, you know, kind of it ends up going straight across from the ischial spines, but the ischial tuberosities like are in front of it in the soft tissue.
Oh.
Okay. Okay, so lots of numbers, but as long as you got the 12s, there's, you know, you differentiate between the 12s and the 13s, full points. And I know this seems really redundant, and this is going to be really important when we're talking about the cardinal movements and how babies are descending and the tendencies of babies when they come in at the brim, either in the AP or in an oblique or in a traverse, because they can all come out, you know, might take a little bit, but babies that enter into the brim in the different diameters have different patterns, not all the time. You know, sometimes you'll get a stinker bug, and regardless of coming in the traverse, they'll swing around the back. Yeah, those ones are fun. But this is also why knowing this, and then when we start talking about palpating a baby, knowing why when you have a baby coming in on the left traverse, which is 13, you know, is happy days, super happy days. We love those left traverse babies. They're going to be more flexed, they're going to be more tucked in, they're going to take
less likely to be asynclitic.
Yep, they're going to take, that's like the fast track. You know, again, it seems a little bit redundant that it's 12 across the boards in the cavity, but you know, it's good, but it's also a little bit of no man's land, because if you get a baby coming in the AP at the 11, you're not really sure which direction they're going to take. Cool if they stay in the AP diameter, you know, because then they hit that, and the cavity is literally at the ischial spines. That's why that hard marker of knowing what the ischial spines are, because the babies, they'll come down and then they'll hit those ischial spines, and then they'll either turn or not. And hopefully if they come into the brim at the AP, they'll stay there, because then if they arc around, it's nobody's fun day, you know. So but that's why this having this mental image is important, and it's going to make more sense, and we're going to build on it when we're talking about cardinal movements and palpating and all that.
And if you have a woman that has kind of an immature or an early pushing urge, that's also a good indicator that that baby might just be hitting the ischial spines. So if you have a woman that you know is not ready to go, she's not shooting any other markers, then you have a good idea in your head that that baby has likely engaged at the ischial spines.
Yep. And that chart is for the majority of women. Okay, so that's a gynecoid pelvis. That's based off a gynecoid pelvis, because a majority of women, statistically saying, they're saying that most women are that shape. Well, okay, cool, but not all women. Okay, so that's kind of the general rule. But then if you get a platypeloid primate
Hmm.
or
Good
you know
luck.
an andropoid primate that has an oblique baby coming into the brim.
Bad panda. And a lot of women with a C platyploid pelvis, they will have babies that are bradycardic. So you'll see lots of D cells because those babies get really hung up in there. I've only seen one confirmed platyploid pelvis delivered vaginally. All the rest of them have been sections for either failure to progress or cephalopelvic dysfunction. So there's, as we kind of move on in the units, there's some ways that you can externally kind of feel for the seat bones on a woman like that. If you look at the gynecoid pelvis A, or not A, but below A, you can see the ischial spines there. And that's usually about the diameter of the top of your fist. If the woman is kind of on hands and knees in front of you. So if you could stick 2 fists into those seat bones, you do not have a gynecoid pelvis.
Yep. And the AP diameter is very, very, very difficult for a platypeloid. And most babies do need to be in the AP diameter at some point for a little while. Not all babies, but and if they don't, like if they engage like in the OP, come through in the OP and come out in the OP, it's a rough day. Not fun. Anyway, any questions so far? Okay, BPP, biophysical profile. And we'll go into
Cheyenne's asking if any of them can increase a shoulder dystocia.
yes.
You can, yes. And you can have a shoulder dystocia with any of them.
Any of them.
With C, you're often going to not even have a baby that can get born enough to be considered a shoulder dystocia. But with an anthropoid and an android pelvis, you can get them born far enough to be considered a shoulder dystocia, because the shoulder has to get hung up on that pelvic brim, either the inlet or the outlet, as far as like in the AP diameter. If you're looking at the sacrum or the symphysis pubis, that's usually where those shoulders get a little hung up usually. And babies that come down in that platypoid pelvis, they don't even get their heads in there. So that would be a CPD as opposed to a SD.
I've had one platypoid and it was a vaginal birth. She really worked for it. It was very long. We had to keep baby in the oblique. And some midwives will say that you can tell exteriorly from, if she's pear-shaped or if she's apple-shaped. I think that's horsewash. I don't think you can tell 100% exteriorly. And some women and not some women, some midwives still do pelvimetry, and we'll talk more about that too. I got mixed feelings about that, but not the point. Where were we?
2 sides of the pubic crest.
Oh yeah. No, we're here.
Biophysical profile.
Biophysical profile. Okay. Okay. TOLAC, trial of labor after C-section. EBL, estimated blood loss.
Are we going to be teaching them quantitative blood loss as well?
Yes, ma'am. Yep.
I want to get a scale for that.
Yeah, I do too. We will. That'll be a fun hands-on day.
Hmm.
The liver has a dual blood supply. True.
And dual, not like they're fighting, but dual, like two.
Yeah, they're dueling. No, I'm joking.
They're dueling. The blood supplies are dueling.
The long muscular tube that serves as a passageway for sperm cells, vas deferens.
Also what they cut in a vasectomy.
Yep. Oh, sorry. So these ones, starting at 41, these are the ones that weren't on any of the quizzes. So these are 2 points, worth 2 points, but you only lose 1 point if you get them wrong. So that's just for 41 through 50.
You may even see some places where they just say trial of labor. That's being
Oh,
used
yeah.
more often now to describe primary C-sections.
Yep.
So if you see that in a chart or somewhere, or someone says, well, I had a trial of labor, that's not the same as a TOLAC.
Mm-hmm. Okay, this is a retractable piece of skin surrounding and protecting the clitoris, prepuce. Okay. Okay. F is the internal cervical os, D is the cervical canal, and B is the external cervical os. So, this to reiterate the fact that the cervix does not dilate the same rate internally as externally. Hold on, I'm gonna pass out this baby again.
And definitely not in primips or nulliparous births.
What if I just put like internal os and external os?
For F and B.
Yeah, I didn't put the cervical, I just put internal os and external os.
Okay, so yeah, D, well, and that's the same. You can only have an os in your cervix.
Yep.
So if you didn't put cervical os, it's fine because
fine.
your os is the opening. It's literally the opening of your cervix is your os.
Yep, internal os and external os is good.
And for 46, I put hood. Is that still wrong?
Yeah, because I think only yeah, because sometimes depending on her individual anatomy, sometimes internal labia minora can actually go up and kind of like what am I thinking of?
Well, so the prepuce is kind of the same thing, but you may have a woman with a larger external clitoral hood because she's heavier or she's got like a pubic fat pad. And it is specific to male anatomy as well. So like when we get into embryology, the difference between the prepuce and the clitoral hood is going to make a lot more sense because it can also refer to the foreskin of a penis.
Yep.
All babies' embryology are girls until they become boys. And so technically I could see where you're going with that when you're looking at female anatomy in particular. But I would say be careful with that because it doesn't specifically refer to that external piece. It's what's
not
happening
unique
on
to
the
somebody
inside.
with a clitoris.
That's a good way of putting it.
Does that help?
Well, I put clitoral hood, but I'm just like gonna trust that it makes more sense later to use that word. I just wanted to know.
Yeah, yeah. It's going to be in the same place. Like if you're looking for it, just realize that it's in the same place, and it's that little extra piece of skin that is also akin to the little extra piece of skin on little boys.
Testes are components of the reproductive and endocrine system. That is true. Okay, perimetrium maintains the anatomical position of the uterus, is also called the broad ligament. Super important. And sometimes huge pain in the butt.
Or pain in the front.
Pain in the front. Yep, huge pain in the front or the side. Or the lower back.
Or the lower back.
Okay, and the last one, after reabsorption, the final daily volume of urine produces about 1 to 1.5 liters daily. Okay, any questions? Okay, so 60 possible points total. Need to get at least 40. And put your total on the front top page, and then send us pictures again, please.
Okay, wait, can I ask a few questions about the earlier one?
Which number?
Well, starting from one, like thyroid gland, I put produces hormones to regulate body function.
Yes, that is correct.
Okay. And then for bradycardia, I put lowered heart rate. I didn't put pulse.
Okay. Yeah, heart rate is the same as pulse.
Okay. For pituitary gland, I put releases hormones, metabolism, growth, reproduction, BP, and then I put the GnRH, FSH, and LH. Like I named the hormones and stuff, but I didn't put it like a sentence for.
No, that's fine. Listing is fine. What number was that? You're way
9.
Dang, girl, should have shouted out when we were there.
So I was trying not to interrupt the flow.
No, I said it, jump in. This is open discussion. Interrupt my role, otherwise we go off on wild tangents.
And then for number 10, adrenal gland, I put small glands on top of the kidneys, blood pressure, metabolism, stress, and reproduction hormones. Yeah, okay. And that was all. That was all my questions.
Okay. Anybody else? Okay.
Oh, hold on. Go back to PIH.
Pregnancy-induced hypertension?
Yes.
What number was that? Oh, here we go.
19.
Okay, what's the question?
Okay, so, well, it's not a question. So pregnancy-induced hypertension is now gestational hypertension, and it's, I hate it. I still call it PIH in my head. Most old school midwifery techs are gonna call it PIH, but I just got bitched at by a physician just on December 3rd because I called it that, and then I put /GTN, which means gestational hypertension. So just so you know, if you guys see it somewhere as GTN, that is actually the new and improved medical inclusive word, gestational, as opposed to pregnancy induced, which is literally the same exact thing, which I told the physician, but they were not happy with me that I did a /.
Was she
But if you
younger
see
than
it
me?
somewhere, it was Dr. Brown, the one that reported me on the Montana side.
She's just splitting hairs.
Yeah, she's splitting hairs. But if you go somewhere and you write it as PIH, just know somebody is going to try to bust your chops because it is now called gestational hypertension. But the midwifery texts that we use are more kind of OG, and it's not in
ATM doesn't even make
all of
sense.
this.
I don't know.
Don't even get me started. Don't even get me started. I just want them to know if somebody sees it, we
Yeah.
are in fact teaching you the correct modern terminology.
Current PC.
Yes, yes. Please press on. Sorry for my tangent.
No, that's helpful because I haven't had enough dynamic interactions with my last few transfers, and nobody's cared enough to look at my charts to say anything. So it is helpful.
Yeah.
Can
Okay.
you repeat how to score it? Like how you want us to add it all up?
Yep. So 1 through 40
40.
is with 1 point apiece, because those were all questions that you've seen on tests. Okay, if there was more than one answer, like this number 25, you have to get all 4 of them to get the whole point. Otherwise, reduce accordingly, like minus a quarter, minus 2/3, minus a half. Okay. From 41 to 50, those were brand new ones. They are worth 2 points if you get it correctly. But if you got it wrong, you only lose 1 point. It's built-in extra credit. So that means there's 60 possible whole points, and you need to get 40 points to meet that 80% marker. Does that make sense? Do you need me to repeat anything? Okay, otherwise email them to us again, please. Please, and then put your total correct on the top first page. Okay, does anybody need a bathroom break or a drink refill?
Did you say there's 60 total?
Yes, there's 60
possible points.
points. There's 50 questions total, but the last 10 are worth 2 points apiece.
Right. And the flip side of 80% is 20%, and that's 12. So 12 from 60 is 48 points, isn't it?
It's by question, not the amount of points.
Oh, thank you. Thank you. Thank you.
So 80% of 50 is 40 correct.
Right. Okay. I got it. I know I got it. Oh, because the bonus points. Got it. I got it.
Yep.
Yeah.
Do you see where my last math class was geometry in sophomore year of high school before my PhD statistics? Bad.
Well, it's just didactics, right? If we're going by points, you're correct. If we're going by the number of actual correct, questions themselves, then it's 40.
Got it. Thank you.
Okay, anything else?
You really don't want me doing math anyway.
Okay,
I'll do the math.
unless there's anything that, even if you got it right, if you want to talk more about a question or topic, anything that was on the test, we can do that now while people are emailing, and we don't need to take a break, just get it in tonight so I can get it in the grade book. Otherwise, okay, sorry, go ahead.
Can I say something about the format?
As long as it's not about my missing ends, because apparently I couldn't end on my keyboard today.
No, I'll send you some other edits, but that's quite all right. I just want to say, I really think, and this is for the benefits of the students also, it's not easy to construct an examination or a quiz format. The fact, I just want to applaud your format. The fact that the hours you both must have spent into building the quizzes, choosing what is critical content to emphasize and hone in on. You're even just tonight, you know, your timing with the spoken cues, you stayed so neutral. It seems really fair, and I just want to applaud how you have elected to emphasize some very important physiological content and constructs you'll be building on.
Well, thanks. Shout out to one of my random anthropology professors in college that did this format, and it really stuck. It really helped me when she did like the built-in. So that's where I got the format for. I can't claim that idea. I got it from an obscure class I had to take, and it really helped my ADHD style brain to have it that way. So I really liked it. So I typed it.
And a lot of the parts of A&P, specifically as a general rule, will not apply to out of hospital birth, believe it or not.
Yep.
So
Yep,
so we're
that's what-
trying to focus on the ones that you're going to see a lot in midwifery circles, and you're going to see a lot in low risk birth.
Yep. And we try to cut it down to what are we going to build on? Like, this is the only unit that is technically A&P, but we're going to be building on these throughout the whole rest of the course. You know, like I said, when we're talking about the ratios, the inlet, the center and the outlet of the pelvis, like we're going to be referring back to that literally throughout the whole rest of, you know, when we have restitution and when we have, you know, dystocias and all kinds of stuff. So we really tried to condense it down as much as we could to fit it into our 5 weeks, but then, you know, don't put all this stuff away. This is stuff that we're literally going to be building on and building on and building on for the whole rest of the 2 years. Okay. Anything else about this unit? Okay. We might have a few more quizzes throughout. I don't remember off the top of my head, but none of them are going to be this heavy again. Okay, where it's basically just all quizzes and a test. Okay. Okay, unit 5. Okay. So this one is broken up a little bit differently. It's 4 weeks and then there'll be a lecture and then we'll have 2 weeks and then another lecture. Okay. I think all of the understanding diagnostic textbooks already went out. That's the only other mandatory required textbook. Everything else you already have. So you'll see the first 4 weeks is in the top. And then, yep, then we'll have our 5th group call on week 26. And then we'll be, the 2 weeks, the 4 plus 2, the 2 weeks is a certification for holistic fertility counseling. So that's what that will be. Does that make sense why it's 4 plus 2?
Yeah, Jane, on the Canada side, Canadian Post, there's a strike there.
Oh,
And
shoot.
UPS is supporting the strike and not delivering. I did know that on my end because I'm waiting for some sweetgrass earrings that are in postal purgatory.
Oh, shoot.
But that could be a problem.
Yeah.
Could we PDF some of those diagnostics?
Yes.
Maybe at least for our Canadian gals.
Yeah. I will start working on scanning these pages in to get these pages for the
And it's
reading.
yeah. And I can see if my scanner is working on that as well.
Okay.
It's been kind of, I found it yesterday in the firebox, so.
Well, fun.
And it's just a recommended book, that book for midwives. But if you guys can swing the 29 or 30 bucks or whatever it is, it's written in a really, really conversational style. It's written to midwives that do service missions. So a lot of the illustrations are, you know, pretty ethnically appropriate. Yeah,
There's
that a book
sections
for
of that one,
midwives by Klein Miller and Thompson.
and there's sections
If
of
you
that
could,
one that I'll be scanning in. And
yeah,
if you,
it just
so
it's a
you'll get
really nice
exposed to it.
conversational style.
You'll get exposed to it, and if you like it, you know, it is a good one for your library. Okay, but I will start working on scanning the diagnostic text pages, these ones.
Jane, is that a book that they can receive now? The
Which
book for
one?
midwives? The book for midwives?
Yeah, if they wanna get it. Yep.
Well, no, because I have some. I ordered some.
Oh, oh,
So I can
Very good.
order, I can put those out, but I'll still send Cheyenne hers, and she'll get it when she gets it, but I'll put those in the mail tomorrow.
okay.
Does FedEx go into Canada?
I don't know. The only ones that we've seen are Amazon.
Oh, Amazon's still delivering.
How is Amazon? Amazon is delivering their private. Yeah.
Yeah.
Well, shoot.
Hmm.
I'll say if FedEx is delivering, that might be something. Or maybe order Cheyenne one from Amazon proper.
Amazon proper. I've never heard of that.
Yeah. Well, like just Amazon itself. And when you look into the delivery, it'll say UPS or Amazon or USPS.
Yeah,
Click on the one.
what
Click
address
on the one that says Amazon. If it gives you a shipping, option, you can click on Amazon.
Oh, okay.
And if there's an Amazon warehouse nearby them, it can ship from there sometimes if they have it there.
Okay. I'll look into it tomorrow. But I'll send out those books because I do have them, because I thought that was on our list. It was on our book list.
Mm-hmm.
It is as a
So,
recommended
yeah.
material. Yeah.
So they can get it now though, right?
Yep.
Yes.
Okay, I'll
Thank
do
you,
that
Auntie.
then.
You're the
Yeah,
best.
I'll get that out tomorrow.
So ignore me when I say get that book.
All right. There is a recommendation for the 2 weeks for the fertility counseling certification is to find a cookbook that you like that is specific for pregnancy, and then looking for an herbal book that you like that's specific for women's health. Right, and then there's just 2 recommendations that we put up that we both like. Not saying you have to get those ones, because you'll find you know what you like, what you recommend will change, you know, and there's lots of them out there. So, and
Those
even
are
if you
really
think-
good though. Those
Yeah.
are really good books.
Yep. So, but that one, this is not for until the 2 weeks with the fertility counseling certification. Okay, but does everybody understand what that 4 + 2 at the top means now? Any questions about it? Okay, do we want to keep our lecture time and our lecture day? Okay, is everybody still feeling good about Wednesdays at 6:30 Central Time? Okay, that, you know, this rescheduling was just anomalous for this one. Okay, we're not switching to Mondays. we're gonna go back to our Wednesdays at 6:30. Okay, and for the same quick revisit for office hours. Mine are Thursday nights and Jade's are Friday mornings.
And I've had some power problems, so I have not been on the last 2 office hours, so I apologize on that. I wasn't, all my electronics were dead. And my house was like 50 degrees, so but that should be fixed. Our propane tank was, for our generator, was out of propane, so nothing was kicking on. So that is now fixed and should be good to go.
Okay, and then a quick visit about Dr. Jen's availability or the school email. Any questions or anything coming up there for anybody? Okay. Quick plug to Dr. Jen. She's a great resource for all kinds of things. So don't be afraid to reach out, ask her a question. Yeah. Okay, otherwise, pretty close to right on time. Look at that, guys.
Look at you go.
Look at us go. Okay. Jade, can you check the email real quick?
I am right now. I'm on it.